Hello, good morning to everyone. I am Elango, Nursing Principal from KAPV Government Medical College, Trichy. I would like to take the class on this online through this video class. I hope that you can understand much better. This will be more helpful for the diploma nursing students, basic BSc nursing students, and post BSc nursing students in our Tamil Nadu state. This video gives some solid information about the particular issues with the solid points. You can understand well by seeing this video. Let's go to the topic. This is my second video, deal about the intravenous therapy. Let's go to the topic. This intravenous therapy is most important issues in the nursing field. The nurses handle this IV fluids with a patient many things, and the purpose of this IV fluids is actually this IV fluids administration will be more helpful rather than taking oral fluids. If the patient taking oral fluids, that takes a lot of time to absorb, but this IV fluids gives better quick effect by means of this administering through veins. Okay, then you can administer some medicines, some drugs through the intravenous, and then this IV fluids also very emergency time. This can be useful to rescue the patient and to revive the patient. This IV fluid administration is very essential steps to understand by the nurse. This is more important, life-threatening one. There are many different types of IV fluids the nurses uses for the patient. Especially these are the 5 different categories that you can see in the PPT. That is isotonic solution, hypertonic solution, hypertonic, crystalloids, and colloids. Let's see one by one. This isotonic solution is actually, say for example, the 0.9% of sodium chloride is the isotonic solution. This solution have the same osmolality as body fluids. That is called isotonic solution. Okay, do you understand that? This increases the extracellular fluid volume. This do not enter into the cells. The isotonic solution do not enter into the cells. Okay. Next is about the hypertonic solution. There is hypo means less, and that means lower osmolality than body fluids. Alright. Say for example the 0.45% of the sodium chloride. That means we used to say off normal saline, isn't it? That off normal saline is the hypotonic solution. This is lower osmolality than body fluid. Allows movement of water into the cells through osmosis. All right. Slow administration due to cellular edema. That makes a cellular edema. So better you administer this off normal saline with slow flow. All right. Next is about the hypertonic solution. This hypertonic is a higher osmolality than body fluid. Allows movement of water from cells to extracellular fluids. The hypertonic solution is about 5% dextrose, the ringer lactate. These are all some hypertonic solution. Next is the crystalloids. The crystalloids is actually, say for example, the hemaxil is the crystalloids, contain so much of electrolytes and plasma level. So this increases the fluid volume and replaces the fluid volume. Next is about the colloids. The colloids, say for example, the plasma fluids, starch fluids are called colloids. This helps to increase the plasma level of the blood. So this is actually the plasma expanders. Pull fluid from interstitial to vascular compartment and increases the vascular volume. Especially this colloids can be given the patient with hemorrhage, severe hemorrhage and severe hypovolemic shock. Next is about the devices, intravenous devices. You can see the device in front of you. This is cannula, steel needle or butterfly set also there. Set is a wing type there is a needle in tip, and there is a two-side plastic attachments like a wing. The needle is actually 0.5 to 1.5 inches in length, where the needle gauge size is about 16 to 26 in size. There are many number of gauges. Let's see about this. There is a plastic cannula. It is a disposable type in nature. So these are all IM needle attached with this, and you can use and you can discard it. There is a calibration here, piston, you can see it. There's a different sizes and different form of needles. This is a steel needle that you can see, the first one. There is a trocar here, there's a cannula inside, okay? So you can use it. There's a both side, there is a wing to attach with the skin. There is a cap actually. In the tip you can see the cap. You detach the cap and attach the IV fluid IV set. This is another one, Venflon type, the same thing, trocar and cannula type. You can remove the stellate after administering the cannula inside the intravenous and just open the cap and attach the IV fluid line. Okay, this is top cap. You can administer injection through this. This is actually butterfly set for the temporary purpose. A day you can use this, and then you can discard it. This is butterfly set. Everything is, this is disposable type. This is also disposable type. You can keep this Venflon for the patient 2 to 3 days maximum, not more than that. Let's see. Intravenous gauges, these are all IV needle, IM needle, and insulin needle. There's about IV containers. You can see 1000 ml containers and 500 ml containers. There's a vent here. This is about you can see the IV containers, IV tubing, drip chambers. The drip chambers are two types. One is micro drip chambers and macro drip chambers. And there is a filter in the tube. You can see by the next slide. This is intravenous tubing. This is a spike at the end for IV bag to the bottle. This is the drop chamber, micro drop chamber, macro drop chamber are there. Next is the length of the tube, and this is a roller clamp. Roller clamp, you can tight and you can loose and flow the fluid and stop the fluid. It's a controller, and you can see the white tube. Through the white tube you can attach the medicines drips. This is the tip. Actually it has to be attached with the Venflon or SV set. All right, this is the way you can attach the white side tube to administer the drugs and medicines. This is macro drip chamber and micro drip chamber. When you want to flow the fluid freely, you can attach the macro drip chamber. When you want to control the fluid, to restrict the fluid to flow under calculation, you can use the micro drip chamber. This is about the filter to filter the fluids and sediment here, and that filter, and free fluid goes and into the blood compartment. This is not actually injection. This is a painless injection type of needleless injection administration. By compressible stretchers. Okay. Then you can see the selection of peripheral IV sites. The peripheral intravenous selection of the site is most important for the nurses, because it is so tedious to select the area. Because most of the nurses they used to apply this Venflon in the joints. That is actually wrong. So better avoid the joints. Okay. So better you start the IV fluids in the left hand rather than starting the IV fluids in the right hand. So this is dominant hand to use more work, that does more work. So better select left hand. That too in the forearm will be better for the patient. Joints excluded. Understand? So the site to avoid is edematous extremities. Edematous extremities should be avoided. The arm that is weak, traumatized and paralyzed hands should not be selected for IV fluid administration. An arm that has an arteriovenous fistula or shunt for dialysis also should be excluded. Don't select the particular hand with the AV fistula. All right. And then the infected area also should not be selected for IV site.